Hello, I'm Dr. Noel Wagner, Saginaw-Tuscola Medical Control Authority. Uh, this session, I want to talk more about concepts rather than one particular intervention. And the concept that I want to talk about is timing. We seem to have developed a habit, or at least a reoccurrence, of getting into somebody's house, saying, "Oh my gosh, they're sick," and then all of a sudden feeling this need to rush them to the truck to start doing interventions in the truck in the ambulance, and that's quite frankly wrong. It's a very old way of thinking. If you want to go back, it's what we used to do in cardiac arrests. I say we, EMS, throughout this country. We'd rush them to the hospital because they're really bad, and we actually didn't really save anybody. We started to realize that working them on scene gave them a significantly improved chance of survival. So starting with that example, we need to be applying that to other situations. Okay, there's things that we need to be doing in the house. We need to be doing it immediately. You don't drive lights and sirens to a sick patient to save a minute or two, to then waste the minute or two not treating them while you haul them out to the truck. And I've heard all the excuses. The house is to this or that. It's better in the truck. I've got my stuff. I know where my things are in my truck. Doesn't matter. It's bad medicine. We need to be treating people in the house uh, for conditions that need to be treated right away. And so, what are those? Well, probably the easiest way is look at your start kit. Here in the Medical Control Authority, we try to make it easy for you to not having to lug in the whole drug box on every call, but we do give you the blue start kits. The blue start kit is a pretty good guide of what needs to be done in the house. And so when you look at the things in the kit, albuterol, Atrovent, yeah, you need to be starting those immediately for somebody with difficulty breathing. Aspirin, aspirin is really, we underestimate how important aspirin is for acute coronary syndromes. Okay, there's studies out there comparing thrombolytics, when we used to give thrombolytics more for myocardial infarctions, that aspirin actually improved your survival better. So it's really important. It's not for pain control. I still see people asking how people's pain are after they give aspirin. So I think that's just a reassessment. It's not really expecting the aspirin to do anything pain related. That the aspirin's occupying your platelets to help with your thrombosis in your blood clot. Aspirin needs to be done right away. D10. We don't carry D50. D10. If your patient is unconscious from low blood sugar, you need to be giving them D10 in the house. It needs to start right away. You're killing brain cells when you take people out to the truck to start your D10 out there. Okay, so start it as soon as you can. Narcan, we're not going to beat that one up. I think we know to give Narcan. Nitro, that's a good one to give also. There are a few drugs in your kit that aren't necessarily time dependent, and we put those in there for different reasons. So prednisone, solumedrol, Tylenol, ibuprofen. Those aren't necessarily time dependent, but we found that putting them in the start kit tended to have us opening less drug boxes, which is more efficient in pharmacy. Zofran, that's your call. Maybe better for you to give it in the house than to wait for in the truck. So, but of the really important drugs, we got to start doing that in the house. Expect redirections. Um, moving on from this, moving forward from here. We've got to do that. We've got to get the things going. CPAP in the house. If they need CPAP, start it in the house. You can take them out on CPAP. It's not an impossibility, and it's the right thing to do. If their respiratory status is deteriorating, we're not going to let them continue to deteriorate on their way out to the truck. BLS providers, BLS ambulances, you've got meds in your kit also. Okay, you've got the albuterol, you got the aspirin. We talked about those. They're just as important coming from an EMT as they are coming from a paramedic. So get those started, and then obviously your other meds are your epi and your nitro. If you need epi, um, we need to be given that right away. Obviously, if they need that. So go back, look at what you're doing. Uh, for a critical patient, your first quick move shouldn't be to move them to the truck. Your first quick move should be to start treatment. Now, obviously, we'll give the caveat here. If it's a trauma patient, that's a different situation. We're talking about medical interventions here, but sick, critical medical patients, start the treatment in the house and then work them out to the truck. It's better medicine. We're going to save more people. Studies are starting to come out showing this. They're starting to get some science behind it. There actually already is some out there, and there's more that shows that delaying treatment uh, to get them out of a house, to get them out of a building is not good medicine. So again, go back, look at what you're doing, and see if that's consistent with what we're asking you to do. We need to do it. It's gonna help more people and it's gonna save more people. All right, that's it for this session. Again, Dr. Noel Wagner, Medical Director, Saginaw-Tuscola Medical Control Authority. Thank you.